with the leadership of Divine Branch Ministries, and specifically I'm talking about the board of directors, specifically from Pastor Bridget Kolade and Pastor Tolu Okonsoya. I've enjoyed tremendous support from them. Then, of course, apart from that, are the awesome people that I work with, my teammates. For me, coming to work every day is a joy. This is a set of people that have stayed with me, and 6 of them have stayed with me from day one. I've been with for 10 years. And so we've got to know one another, understand one another, and a couple of other people have joined us in this period of time, and it's been a pleasure working with them. They give that support for me to keep on coming to work every day, and for me to keep on keeping on, and for this, I thank them most sincerely. Of course, it's my family, my wife and children. They've been a big support for me, encouraging me in this work, especially my wife, because now the children are leaving home one by one. She's been a tremendous support for me, and I want to crave her indulgence to bear with me a little bit more, just a little bit more for that support, and I believe that it will all go well by God's special grace.
Good afternoon, Sirs and Mass. Well, I really want to appreciate everyone for making our time to have one engagement or the other, or you steps, and by God's grace, I believe that our prayers will be answered in Jesus. Starting the presentation, and the presentation will be done today by our medical director. I think we've seen him on a couple of videos there. So he'll be taking the presentation.
Hello, 1, 2. Just here. Okay. Good afternoon, everybody. Yeah. So, can I have the slides, please? So today we'll be talking about male infertility. Male infertility. It's going to be a short presentation. Have questions, just don't, and then I'm very happy to answer these questions as it. What's that, Victor? Just coming on. Okay. Then anyway, so that's what. By way of introduction. By way of introduction. Infertility is inability of a couple to conceive despite regular unprotected intercourse for 12 months. Regular unprotected. So we're saying intercourse at least 2 to 3 times per week for 12 months. If there's no conception, then we say, oh, a challenge with conception. Now, I'm saying that because at times people come after 3 months. 6 months of marriage. We really don't have to say there's a challenge with conception then. It has to be for at least 3 times per week intercourse for at least months. So we say regular unprotected intercourse. Okay. Yes, please. Okay. Yes. So for some people, we don't necessarily wait for 1 year. There's a challenge. For some people, after 6 months, especially to bring about you 35 years, to about over 35 years. Don't read. About regular, irregular periods. Or to like endometrial, will be after intervene. If I want ọkùnrin bá ti ṣe operation rí lórí kórópọ̀n, we want to intervene, or tí ọkàn bá lọ, one the other. We don't have to wait for one because already issue, and the issues, the better. Okay, so when we talk about conception, this is how it happens. So this is what we call the womb. This is the womb, and that is the fallopian tube. So what gets to happen? It's released. This is what the man released in Ilosho. It happens in. So till over and you might travel by. Woman want the fallopian tube. Okay? So I want the fallopian tube. Now, these are the activities that happen. So in the fallopian tube. This is the egg, these are the sperms. So to fertilize, after 2 days, it becomes this. After 3 days, comes that. Then it continues to grow like that. And that's why Taman said, before we say there's a challenge with conception, number one, to be sure, how well is the egg producing, ovary producing eggs? To be sure, is fallopian tube open? Number two, to tell, the sperm can, but sperm, that I have sperm is not enough. And ejaculate 5 times in a day is not enough. What is the Are you still with me? Or you okay, let's go. Okay, so how common is it? 28 will have a challenge with conception. So it's quite common. We'll have a challenge with conception. That means that in about 4 people, 1 person will. And we have to face it squarely. So now, for 30 of them is because the challenge will. 30 of them, another 30, there's a man and a woman. And then we now have 10%. Because all the tests are but that do we understand that? We go home and I wait for 5 years. By the time I'm seeing them are 38, they are 40. You understand? So we pay because in our world make enough tests to the problem is. But that's a possibility. Anyway, so for men I've said okay? For the woman, I'm a fair wo. Number 1. 2, only quantity. And then number 3, basic things that we have to do, and it's important. I appreciate that some men are here today with their partners. That's fantastic for men. So some other one will talk about female, but for men. So some other one will talk about female, but today we're looking at men. Okay? So we can look at this is the normal one. Okay, anybody be what does it look like? Can anybody like an egg, yes? Oh, it looks like a tadpole, Abby. Yeah, it has a head. Stick. Okay, any other suggestion what it looks like? Microphone. Okay, it looks like a microphone. But abnormal microphone, Abby. This one is an abnormal phone. But you just look at the tadpole. Yes? So here we can see this is a normal one. Now, the next what's abnormal? Okay. What about this one? What's abnormal? Please. Check longer. This is what called abnormal morphology. Abnormal appearance, abnormal. Okay? So when it's abnormal like that, only if I daduro. So say abnormal sperm. So at times the sperm is not matured. At times the shape is abnormal, just like we saw. At times when they swim dada. Because that picture I showed earlier, it had to be a vagina, not in the fallopian tube. So by then they swim dada, that will not happen. Okay? At times count a low. At times there's no sperm. All of these are possibilities. And Tim Bashi, do we understand that? Yes. So the sperms have to be examined. Katole saw what is going on. Then at times, you can the sister. Goes back into the bladder. And so, of course, it will be difficult to get pregnant. Then, of course, some people, they are not able to have good erection. So, if there's no good satisfactory intercourse, then again, the blockage. And when no point is in the testis, but it's not able to come out. Because like you have to, and the pipe is blocked. The pipe is about blocked. Water come out. The water will not come out. Same way. Okay? So at times there is exposure to toxins. Toxins are chemical. Became just his driver. So what with Coca-Cola? I selected by him. After 1 week, it's like real life story. Story. Said 1 week. And you know, we're young guys. It was like 24, 25. So that's heat exposure. What are the challenges we're having? Some other people will not know. I'll tell you another one. At times, as young people, Odrosi Express, focus on the trailer, engine of the trailer. This is getting fried for 6 hours. By the time you do it 5 times, heat exposure. Then the exposure will come a lot of one but in the Western world, a whole bathtub of hot water, and now we sit inside, and it's testing hot water. Because I tell people, the testes to be outside the body for a reason. It's for a reason, because the temperature has to be kept cool. So maybe we don't do that commonly. We have a shower of hot water, okay, which is okay. But sitting inside what they call sauna is not advisable because of things like this. Okay? Medications. So we have drugs that we can use. At times blood pressure drugs can affect sperms. Okay? Then ulcer can affect sperms. Then drugs that we give for depression, for psychiatric can affect sperm. These are things we need to know. Then recreational drugs. I'm talking about things like heroin, cane. Taking it is here today, but alcohol and tobacco also say expect We then environmental and lifestyle. Okay, sexual to part of this. Unexplained is that it does but in to bring normal. So I said this happens in about 10% people that recover. What are the things we can do to help? Can you hear me well? Excellent, thank you. What are the things that number one, sperm boosters. Sperm boosters. The benefit on have 10 people. Share with me. 10 people to buy me to buy from paracetamol. At least 7 on 8 should be better, Abi. Aha. Because by the time you say this drug works for this, you can predict benefit there. When you have 10 people that have immunity, and then you not give them sperm booster, they don't tell you, so it's difficult to beat your chest and say it works. Do you understand? And to share from January, only low, so that's what I mean when I say the benefit unpredictable. So if you get a drug to improve sperm parameters, use it. That's what I know. But my experience is that, let me also say, so if I have a drug to low, after 2 months, should I see improvement in my sperm, I should see a specialist. Now, my experience is that I've seen people what's looking for the last 3 years. Still, there's no pregnancy, and he's continue using it. If it's going to work, in the first 6 months, so if I'm using a sperm booster in 6 months, and my wife and my sperm is not getting better, or better still, my wife is not pregnant, that drug is not working. And I'm saying this because the earlier we get better. Okay, fine, antioxidants. So there's some medication we call antioxidants. So what antioxidants? They help cells actually recover from cell division. Let me just put it that way. Okay, so things like Adizua, fine. Adizua is very rich in antioxidants. Okay, things like Oligocare, very rich in antioxidants. Okay, things like coenzyme Q, they're very rich in antioxidants. Hormonal medications. Now, hormonal medication, you say I put there not advisable. I can tell a real life story. And Matron is here, and a few of my colleagues will confirm this. I read patient from the sperm count was saying 5 million. And then we counseled her on what to do. And he went to see a doctor. The doctor gave him a drug. I'll mention the name of the drug. It's a testosterone, the common one. Proviron. Use Proviron. Proviron is a testosterone for 3 months. When I saw him there was no sperm. From 5 million, there was none. This was like 6 years ago. I still saw him this year. There's still no sperm. So, hormonal medications are advisable. And that's why it's important. Fertility condition. Understand the problem in our country. They're not even gynecologists to start with. That's it. Understand that. Varicocectomy. cold water. Yes? So I have cold water. It's taking the hotness from the tea. Is that true? That's what blood supply does to the testes. So the blood is cool. We'll be making the testes cool. But what happens with varicocele is that because it's abnormal, the blood is hot. So the testes will be what? Okay. The testes is hot. It will not produce sperms as it should. Okay, so I said good blood supply keeps the testes cooled. Overheating causes abnormality in sperm production. Now, for me, so what tends to happen? Tabashi operation, that's a correct varicocele. Yeah. So varicocelectomy is the surgery to correct that abnormal blood supply. Okay. For many people, the sperm count gets better. Like had varicocelectomy, the sperm count go, and the wife got pregnant. Okay? But for some people, the sperm count actually goes low, the surgery. And for some people, difference. So because of that, I'm going to say, if you do a surgery, if it will work, it should work within 6 months. If there's no pregnant within 6 months, see a specialist. Because me said surgery 4 years ago, say surgery I should do, Emma duro. Because to ma shishe, where you go to shishe. And that. If no conception in 6 months, see a fertility specialist. Okay. Bowel mixtures. How about? Well, maybe I'm not qualified to talk about this because I'm not a tradomedical practitioner. You know, but people can say, okay, you understand? Because Orthodox God not be training me. Okay? I can't say they don't work. Okay? But someone that is trained in that can give you better information. You understand? But what can tell you to improve sperm all the time that it works. That I can tell you. Okay? So we have to be careful. Okay, so how to prevent infertility? We talk about safe sex. Safe sex is infection. Avoid tight fitting on, as I said, so that the cut down alcohol, cut down smoking, regular exercise. Avoid radiation. You know, we call something laptop. They say the worst place to put the laptop is on your laps. That's the worst place. Because the laptop has its own generate radiation. And the radiation is going to the person's groin. Oh. Actually, laptop, you know, it will blink. Even though there's no direct connection to it, it will blink. Or there's thunder outside, it will blink. That's because the radiations is working with radiation. So we have to be careful of, okay, avoid radiation, laptop. We say don't put phone. Okay. Pocket. I still put my phone in my pocket. Well, mostly I hold it. But at times I put it in my pocket. Diet. So when you talk about food, we say the more natural the food, the better. That's important. The more natural the food, the better. Good example now. Between Zobo and Coke, which one is natural? Okay, that's simple, isn't it? Yeah. Okay. Between honey and what is natural? Okay, fine. So you know what? Many food, one preservatives. I mean that those preservatives toxins are very, very important. Not even then healthy, but by the time or transform into something that's poisonous. Okay? We need to realize okay. So what we do in that case is what we call it. I want someone to pronounce this word for me. Anybody? Of course, I'm not, apart from my colleagues at work. Anybody? Okay. Can someone help me pronounce next word. Wait, Emma Jeka together. And the control Nigoya. No, madam, don't do it. One person. Okay, I try. No, but okay, let's give that guy a round of applause. You tried. Okay, the next. I'll try with this next one. The next. Yeah. No. Emma, let's be. Okay, very good. Yeah, so those are the kind of things that we do to help. And what we do is, I will show you a short video of what we do. Is any around? Tunde, is this video here? It's a part of video meal. Who changed the laptop? Sorry, no, it's supposed to be here. Okay, fine, I've seen it. Okay, I've seen it. The video. Fine. So you can off the lights, please. Okay, fine. So that's pram. You can see. To an egg so that we can make fertilization happen. Okay? So you can see the size of the egg compared to the size of the sperm. The egg is about 1,000 times bigger than the sperm. So let's just be patient. So this is what we do upstairs. Male factor infertility, we call this ICSI, intracytoplasmic sperm injection. Okay, so that's the egg there. This one, I'm going to stabilize it. We've stabilized it. This is in the lab. This is in the lab. Now, so it's going to happen. So, called ICSI. Okay, that injection to this sperm here. You can see the sperm there. Okay, you can see the sperm is going in. I see growing inside, right? Yeah, so we insert the sperm into the egg. So do for ICSI. And so what we do now is that if there are 10 eggs, we just need 10 sperms. Okay? You can still keep the lights out. Oh man. Okay, fine. So those are the kind of things that we're able to do to help us. Yes. Okay. But koto diekwe a fertilized sperm and egg. Some things that has to happen. Okay? Number one, we have to stimulate one to produce eggs. Do you understand? Number two, we have to collect the eggs. Okay? Then after we collect the eggs, we transfer sperm into the egg. After that, we keep it in incubator, and after an embryo transfer. So those are the kind of things that we know that will help us achieve conception. That thing called ICSI. At times we do it, many times it works, and at times it doesn't work. Okay? So one of the things somebody determine chance of success is the age of the woman. If the woman is less than 30 years, the chance is about 60%. After the age of 40, for a woman to low eggs are rare, the chance is less than 10%. Okay? So, however, so when we have the older woman, to lower we call egg donor, the chance of pregnancy is about 65 patients. Round it up around about 5 minutes. Please get your questions ready. What are the complications? And do IVF, not build IVF. The fact that at times cooking shisha is at times people may respond too much to the drugs. Something with hyperstimulation. And at times you have multiple pregnancy. Now, multiple pregnancy in this part of the world, but the complications are more. And so in other parts of the world, say this. That's what they say in other parts of the world. If you have to put inside, you have to send a letter that quick coffee BGC. Okay? Then at times we have something like ectopic pregnancy. Ectopic pregnancy meaning we fallopian, image the fallopian tube where the egg was getting fertilized and all of that. Uterus or womb, and then it continues going there, and that can be an issue. Then at times, and that's what we call heteropregnancy. Then of course, at times you can have miscarriages. So this oldest mother in Nigeria, she gave birth to twins, a boy and a girl at the age of 68. 68. There's a whole lot of discussion about going to that. But for us, after 55, we don't do IVF. There are other things. Remember someone who in the hospital that she was then less than 60 and she was 58. Even remember when we have men over work together here. I have a what's the point? So it's not, some of them are not worth it. There are other things only consider adoption, surrogacy, yeah. But before the age of 55, we'll do all we can. Assist as much as we can. So this is the oldest mother in Nigeria. This is the oldest mother ever. In Sri Lanka or India, I can't remember. She's 72. She wrote, I wrote see her that she had a baby. These babies, she couldn't get out of the house 1 whole year. House. That come with these things. We have to do it. It's not do it. It's not just about what about that of those things in taking the dish. Thank you very much. So, Dr. Jen, is Dr. Shelley around? Can you help us with questions, please? Yes, we'll welcome questions and comments, please.
Thank you. Thank you so much, sir. Do we have questions? So that, okay.
Good afternoon, everybody. Okay.
Yeah. How many questions so that we can look, or you can start preparing your questions? You can ask the issue,
Okay.
so that you can be whatever you're comfortable with.
Okay, good afternoon, everybody. My name is Oluwabukunmi. I've been married since 2001, that's 24 years. And I had first degree in fertility and also second degree in fertility. Doctor, when you were talking now, you said 10% unexplained factors. I could remember when this challenge of second degree started, because after the first degree, I got pregnant after like about 4 years. The first pregnancy I lost at 6.5 months. The second one, I lost about 6 months. But the pregnancy were coming. Maybe after the second month, I would get pregnant again. The pregnancy, so I was happy that there was success. But at the second degree infertility, after I had my baby, that was the third pregnancy I had my baby. After that, nothing came. And I went to series of gynecologists. I did all tests that was meant to be done, everything. So they didn't tell me under the 10% unexplained factor, they didn't tell me anything. Like you mentioned now that I was expecting them to, madam, this and this was what happened. So they didn't explain anything to us concerning the unexplained factor. I don't know whether lately they've started to discover all these things that you are saying. So my second question is that under environment and lifestyle, you talked about medication. And my husband happened to have BP, and we noticed that the BP drugs usually reduce the sperm count. Doctor, I want to know whether there is still chances of him being able to have quality eggs with the medication. He doesn't take it every time, but he's still on the BP medication. Then my third question, doctor, okay. Okay. So my third question, under hormonal medications, you talked about Proviron not being healthy, but we were placed on large amount of Proviron then. We were constantly using Proviron. All these things I'm hearing, they are news to me. So when you say they are not healthy, so we've taken a lot of unhealthy stuff a long time. So all these things, please, doctor, I don't know whether there is still hope with all the lectures I've just heard. Now I'm kind of like getting discouraged that Proviron that we have taken for long, we were practically buying it on the shelves without he telling us to buy it again. So those are my okay.
You remember the doctor saw see, it was an old practice. And that's the question I ask all the time. You not see Dr. Jeremy, Dr. Shelley, you young people writing, because what the knowledge tells us now is that it's not safe. For the last 15 years, it's important to update yourself. Okay? You pay more in school, 25 shouldn't mean you got to man. You see that? So that's the problem. It was an old practice done by the more senior people. And that's the experience. Anyway, blood pressure medication. So it will be, well, it depends on the drug he's using. But I think you should see his doctor who will change the drugs. Some drugs are more friendly than others. Number one, blood pressure should be brought down. Aha. So it's just a matter of changing sometimes. Yes. The unexplained infertility. The unexplained infertility has been around for a long time. Again, it also depends on training and retraining. It's been around for a long time. We pay kosi koto wrong. You should still have an intervention done. Because how long have I do that? Okay? To answer your questions about him, let us see. Okay, let us see. Let's have a discussion. Yeah.
Thank you so much. Okay, number 2. Thank you. Good afternoon, everyone. Good afternoon, sir. Thank you so much. I really appreciate it. My first question is that I'm sorry. Please, sir. The first question is that about Oluwabukunmi drug. Is it not study for us? Because we still have it at home for my husband. What happened is that I had like 3 pregnancy. I'm married 2023. but I have miscarriage. Okay? And it was my husband that impregnated me. So I don't know what happened. Later, when we did what do you call it? The sperm counting stuff, we asked to do it, and they said the sperm counting is bad. He's the one that used to impregnate me. I don't know what happened. So that's one. Okay. Then two, somebody like me, I don't like waiting. If, when I take one process and I see that there's no improvements, by myself, I will ask around, and I will take another decision and take another step. Excuse me. So I took a step on my own by doing a HSD. That thing is very painful. I almost died. So, they said I have fallopian tube blockage. And, when I had these miscarriages, I did evacuation. And after that, I went back to Moroccan to do, what do you call it, scan, to know whether everything is clear. They said nothing. What caused this? I don't understand. So, please. And is there any other way we can know this blockage, whether it is true or is still there, apart from that HSG? Very painful. Thank you.
I got the question. If their life is unfair. So, it's very possible. So, from our own deduction, what that just basically means is that your air quality must have been very good for pregnancies to happen. I don't know if you understand what I mean by that. Okay, so even if the sperm count is a bit lower than what is expected, and the air quality is very good, and other factors are normal, it's still very possible to get pregnant. But the example that we usually give is that if a man has issues with his sperm, and maybe his wife is like in her late 30s or 40s, and pregnancy is not happening, and that same man, maybe has the second wife or has, someone else, maybe something, and that one now gets pregnant, you start wondering that what exactly happened. So there's usually a form of compensation. Okay, if sperm quality is not too good and the air quality is quite good, pregnancy can still happen. Okay, so that's for that. Then for the blocked tubes, sincerely speaking, this is the only thing we can pinpoint to. I mean, in terms of the evacuations we did. Okay, but the truth of the matter is, it might be related to it, and it might not also be related to it. Okay, but for you to have been able to get pregnant, that means that at that point in time, your tubes were fine. So the question now is, was there an issue after the evacuation? Because it's possible. Apart from, seeing products, things inside, there is a subtle infection. There's something we call endometritis, an infection that can spread to the tube and eventually block the tube. Okay, so what we advise is that if you still want to ascertain your tubes are open, there's a test you can do. We call it laparoscopy. Okay, it's not as bad as you'll be given something to sleep and all that. Okay, so you can do laparoscopy, but the other way is to consider the possibility of IVF. You don't really need the tubes. You bypass the tubes.
Sometimes several people that low sperm count. How low is low? Do you understand? There's some that you see male now, they don't even have. For the fact that you are producing semen doesn't mean there are sperms inside. Lot semen, but when we sperm, until when you actually move directly scope, then semen have sperms. Now, how the low that you're talking, I tell people, you just saw that short video. They picked only one sperm. And what WHO is saying we should use is 15 million. Anything below 15 million now is what we call low sperm count. But there's still maybe 1 million. We need just one sperm. So that's why he's saying that if the quality of the egg is good and someone has 5 million, it's possible that the egg will compensate for that low sperm count. So it's possible for you to that process of HSG because of the pain. Also, and then the excess fluid, the dye that they are putting, tubes can go into spasm. And it will now look as if the tubes are blocked when they are looking at the fins. And that system feeling the pain during laparoscopy. So we can actually use a direct camera that we are using to look into the abdomen. And then somebody is helping us to push that dye, and then we can see, okay, this dye we can sure that is it actually blocked or not blocked. But if you don't want to go through that, you could just do IVF. Thank you so much. Question.
Thank you. I don't know. I came out with a bit. I got my 2000. Yes. I can even because I have so I don't. All right. I don't know. It was after my first pregnancy that when I lost it, I discovered that I O negative. I want to ask, is there any now that okay? I want to do not that I've not been pregnant with that one as now that if I want to do IVF now, is there any chance or I don't know because I was told that O negative has negative impact on pregnancy. I don't know without certain injections. I don't know. So I just want to ask with my O negative, is there any chance for me for IVF? A second, I think you get my question. Antiviral injection, something, yes. So my second question is, sorry, I wrote it down. My second question is, for someone that has a bulky uterus, does the person need to go through surgery before IVF, or can one just bypass it?
Thank you so much for your question. O resource negative. Okay, it's not a contraindication. It doesn't disturb IVF. There are different types of blood groups. Okay, O, A, B, then we can have a combination of A and B. Now, there's something called resource that we also check for. Some people positive, they can be O positive. Now, some people are resource negative, they can be O negative. We can have A negative, have A positive. Likewise, we can have B or AB. Okay, now makes the difference is that when you are resource negative and you're pregnant, okay, during pregnancy, if you're actually going for antenatal, especially for the first time, and most times, except they've had pregnancy or something, we always do antibody titer. We check if you have exposed to a positive positive blood before. So we are looking for. So if you're negative at that time, most of the time we will give you what we call Rogam, anti-D. Anti-D, most times 8 weeks. Then we also tell the patient, if your midwife, let your doctor know, I am negative, there's an injection, that same Rogam, we will give it to you 72 hours. You must injection at least 72 hours after your delivery, after 1 week. But we find out now that if people don't even of the cost. So that first pregnancy is not being affected. If in the second pregnancy, because with little quantity of blood, okay, where this is real medicine now. If your husband, let's take it this way, if your husband you're also negative, if your husband is the owner child, that child will definitely be negative. Okay? If your husband is negative, the chances are that child may take after be positive. Okay, so if there's any chance of mixing of your blood and that baby's blood, maybe free, or maybe during pregnancy you're bleeding or something, your body will react to that. Develop antibodies. That's what we check when there's mixed to that first child. But in you have pregnancy, and that pregnancy is now your body will say no. Fight that pregnancy as if it's brain body to you, and there will be a miscarriage of your son. So that's why we always say, take that Rogam, whatever antibodies you have released, it will clear it. Okay, so it doesn't disturb. The only thing we would need to do probably is to check your antibodies. Have you been sensitized? And that's why when you need to keep saying it, I'm ready. Or that resource is very important. So they cannot transfuse you with a positive blood. You're going to react. Stop our own. Going to need a donor, whatever. It doesn't disturb because we're not transfusing blood. Okay? I don't know if I've answered the question right now.
One other thing Madam wanted to know is that rhesus negative, does it cause infertility? If there's rhesus negative woman marries rhesus positive man, will it cause infertility? Yes, you can have IVF. It's a test we'll do. It will help us know if you are sensitized. If you are not sensitized, you can go ahead and do IVF. If you are sensitized, some things will happen. So,
now, uterus. What is making the uterus bulky? There must be something making it bulky. So a scan will sort that out for us. Like for everybody, not like we say a woman should not get pregnant. So that's why. That's why you need to see. A lot of you see a fibroid even bigger than the baby. It does happen. So there are some fibroids that can't see. Those are the ones that needs to be removed. If it's close to where we're going to transfer what we call the endometrium, the endometrial lining, submucous fiber, then we may need to take that out. Not really a bulky uterus. We're going the endometrium is important for us. You see, for some we will definitely say So I don't know if I've answered your question. So we need to know what is making that uterus bulky. A lot of times it's not even meiosis that is making it. So we need to know what is making it bulky. I don't know if I've answered your question.
Good afternoon, sir. Please, I'm very sorry I came late. I don't know if this has been treated. I want to know if one of the fallopian tube is being blocked, if there is a way that, if there is an help that can help it to be true. That's my question, sir.
For that question, check the picture. We have is a right tube. Okay. So what she's now is if blocked, can the person sit or be opened? A question. I would maybe if you have that picture of the tube again. One thing I used to tell people is that days before IVF became very popular. Look at this. This is because it's a drawing. If you see this thing in real life, in fact, you may not even know that it's a tube. You understand? This is so. Then in those days, I used to say before IVF became very popular, we used to do surgery. We used to do surgery to try to open it up. That's your question. But if we do take surgery, block tube, probably won't. So we found out that why are you opening somebody up? As in open surgery, you take that person to the theater and go and play because a lot of people outside will say Oshimich. Those things are, most times they don't work. They just want to maybe meet away from you or something. They will say they are flush. They want to feed here and then maybe who was thing. So, but anyway, we used to do surgery for it before, but it's not very successful. And now that IVF is almost everywhere, why will you do surgery and then make a woman more when you can do IVF? And now, if one tube is blocked, I used to tell some of the patients when they come, they will say maybe one side is blocked, the other one is open. To me, it's like both tubes are blocked. It takes grace of God. It takes like a miracle for one tube, especially for an older woman, to be able to get pregnant. Why? This is the ovary here. That is blocked. That's why people. You tell your brain, this that should be not. Let's say this right. Brain, my left tube is blocked. Egg, don't that be producing. It's only you, right side, that should be producing egg because the left is not working. So it takes grace of God. I will give you an example of my own friend. When she got married, the first pregnancy was an ectopic. If you know what ectopic means, it means the person pregnant in one of the tubes. You understand? No. Implantation starts here. The egg and was meet here. That's the idea. This egg and the here, they will now become one. They will now move themselves to this place. This is where pregnancy starts from. Okay? Now she had the ectopic. One was removed. Main one. And God so was passionate to her. She had pregnancy, one boy. Had another pregnancy, a girl. The fourth pregnancy, another. Okay? So, what is the treatment for that lady? IVF. If she still wants more children. Is that clear? Have I answered your question? took the doctor said that as he took amlodipine along the way when I went for TPS scan, they noticed that the heartbeat is not okay. It was there around 8 weeks by then. So the reason why I know that is I'm lodipine that I took. If I took it, my vagina will be aching me, and I called them. They did not pick my phone. They say the baby is expanding. The baby said you have not seen the blood. I said the vagina is aching me. So that's why I lost that one. I did another one too. It was fail, and I want to. And I'm scared now. I want to ask maybe can I do another one? I'm hypertensive. Yes. I still do.
Know your age. You have to know
Because of the BP, I'm hypertensive.
blood pressure.
Yes.
Okay, I get the question now. We can be managed. Or it can be managed. The amlodipine that you stopped off. Okay. Take home message. Yes. Okay, the only thing is all we want to be sure your high blood pressure is under control. Because high blood pressure and it doesn't stop at IVF. But how can you be pregnant and then you're 6 weeks, 8 weeks pregnant, or 20 weeks pregnant, and then the blood pressure is not being controlled? We had it in our medical center. We had to counsel the patient that which one for this pregnancy. It wasn't IVF. That one wasn't IVF. Quite all right. But a pregnancy, she wasn't seeing. Do you understand what we're saying? So blood pressure needs to be controlled, but it doesn't disturb IVF. It needs to be controlled so that we don't start about you contaminating the pregnancy. Nobody wants to be on dialysis because and then you're also pregnant. You have to take one. You understand what we're saying? So blood can affect the of that woman. That clear? All right. So that we can start our consultations. Have we tried to answer all questions? Are you happy? Are you happy with us? Okay, thank you so much. Okay, yeah. Bó mo ń sọ látẹ̀ẹ̀kan ẹ má bínú ṣé ó yé wa àbí kí n ṣàlàyé ní Yorùbá? Ọ̀táǹtì ni mo ń pè ní ọ̀fun mi mo lè wọ́n tá à ń pè ní bí IVF yẹn in the lab ní tún tí àwọn amú yẹn látara àmúlá yẹn ọ̀yẹn àṣeṣe àjò was a lot of àṣebó tó bá ti dé. Àwọn different nǹkan
ṣe tí pé actually àwọn pé àwọn yàkà ètè kò sí tí jù bẹ́ẹ̀ ìtúkú ẹ̀yìn ẹ̀yìn mi. You understand? So take home message meaning see maybe my boss has something. So do you have something else? Show Yoruba. Yoruba. Let me give chance. Tabani ìbéèrè ní Yoruba. Pé kó lè tún yé wa dáadáa. I can't. I'm down. In Yoruba. Táwọn obìnrin ṣe ní last time yẹn la be the next one. Next one. 3 months now. Follow us on Facebook. Well, yeah, I think are we on Instagram? So you can always follow us. Thank you him this morning, and then for a free consultation, so you can discuss your problems with us, and then we tell you the way forward. So I want to back Kolade first 20. Ogun to Kolade. So and then that will be the.
Thank
Bismillahirrahmanirrahim. Okay. Thank God Almighty, the most merciful, that allowed us to participate in this conference. Of every people here, all our problems, our issue, the infertility, I pray the Lord grants all our wishes. Treatment, the medicine, everything. I pray Almighty Allah make it work perfectly. Everybody that came here today, I pray Almighty Allah make us return home peacefully.
Thank you for coming. Thank you.